Hi guys, this is Nikki, lead vet tech with PoshDogKneeBraces, and today I want to go over diagnosing a CCL tear in a dog. So first off, do we at Posh recommend having a diagnosis before purchasing a brace? Answer, yes, we do. Just because there could be several issues going on that could be the reason your dog is limping. They could have a sprain. They could have a groin sprain. There could be an issue in the hips, the spine, the toe, lots of problems that can occur to cause lameness in a back leg. So it is really important to have things diagnosed. But I'm going to go over some different checklist of things to make sure of and to ensure that your dog is being taken care of. So first off, the first thing your vet is going to want to do is called a drawer test. So this is a way that they manipulate the knee to check if there's any laxity. So first off, there's a ligament in the back of the knee. That's the CCL right there. It forms an X. That prevents the tibia from thrusting forward. So what they're doing is they're checking to see if there's any movement in the knee. If the tibia shifts forward at all, that kind of gives them an idea, okay, that ligament is not working. Something is going on back here, whether it's a partial or full. They can't tell you. I have a lot of people say, well, my vet says it's a partial, my vet says it's a full tear. The only way to diagnose that properly is through an MRI or going internally surgically to see. So it's just the best guess. All they know is that there's movement in the joint and we go from there. And so that's the first thing they're going to do. The second thing they're going to want to do is X-rays. So X-rays can be good and they might not be necessary. So first off, X-rays on a dog that's over 7, I do recommend. We can rule out arthritis, degenerative disc disease, hip issues, spine problems, tumors. You know, there's lots of reasons they could be limping. So it is good to take an X-ray. Now, if you're going to take an X-ray in the clinic and we're trying to diagnose a CCL tear in a dog, I would recommend having those X-rays sent out for a radiologist. Just like in people, clinicians that work primarily in the clinic are probably not the best at diagnosing orthopedic issues on an X-ray. They can give you their best opinion, but it's better to have those sent out to a radiologist to actually give you a for sure answer on is it an ACL or a CCL tear. So again, I would have the radiologist check for findings. They can tell if there's a distance issue. So when our ligament is torn, there's an abnormal angling in the knee. So they can check for that. They can measure distances and tell you if there is in fact a CCL tear. The third best option is an MRI. However, those can cost $1,000. So most people choose not to do an MRI on their puppy, which is fine. We don't require an MRI at all. Unfortunately, I wish we could do one, but that's not an option. So when we're doing a diagnosis, it is important to find a veterinarian that you can trust. Find somebody who is going to be very gentle with your puppy and that's also holistic minded and will be okay with your wishes to use braces. So again, make sure that you make that appointment first thing in the morning or the last one in the afternoon so you avoid the veterinary rush. That way you have more time in the room with them. You're not waiting in the exam room or in your car at this point, waiting for somebody to get back to you with your dog who is maybe stressed. So again, when making appointments, find somebody who's gentle, somebody you trust, go over, what your concerns are with them, and hopefully they can be a little more holistic minded with you as far as treatment plans go. We leave diagnosing up to you guys. It is not a requirement. It's just a recommendation. Again, we just want to make sure that we're treating the right thing. Let me know if you have any questions. PoshDogKneeBrace.com. Thanks. Bye.